Hello class, and welcome to today's lecture where we will be focusing upon psychotherapy. Now, psychotherapy is a form of treatment for various mental health conditions, and there are numerous types of psychotherapy available, and each approach offers a unique set of techniques and tools for treating different mental health issues. So today we will focus on three primary types of psychotherapy. First, we'll look at psychoanalytic psychotherapy, then we'll take a look at cognitive behavioral therapy, also known as CBT, and finally we'll take a look at humanistic therapy as a broad category. And we'll examine the history of each of these approaches and their theoretical foundations and some techniques used in each modality. And further, we will explore the effectiveness of each method, the conditions that are most suitable, and some of the limitations. Now, because this is an introduction, we're not going to go into extreme depth, but I do want to introduce you to the basic ideas for each. Now, the primary goal of psychotherapy is to help individuals improve their mental health and their overall quality of life. And this is achieved by various approaches that seek to address the underlying psychological and emotional factors that contribute to a person's problems. Now, psychotherapy is a collaborative process that involves a trained mental health professional and the patient or client, or depending on some parts of the world, they call them the customer. The therapist helps the patient to identify and work through difficulties and develop healthy coping mechanisms for managing their symptoms. Psychotherapy has a long history, and over the years it's undergone significant developments and changes as we've developed our research on the topic. The evolution of psychotherapy can be traced back to the work of people like Sigmund Freud and the father of psychoanalysis. Now, Freud developed a technique of treating mental health issues that involved exploring unconscious repressed emotions and early childhood experiences. And this approach formed the basis of psychoanalytic therapy, which became the first widely accepted form of psychotherapy. Now, as the field of psychology evolved, new therapeutic approaches emerged, each building on the previous one. And so when we look at CBT, cognitive behavioral therapy, for example, it was developed in the 1960s as a way to treat mental health disorders by addressing the relationship between thoughts and feelings and behaviors. And so it's a more relatively short-term, problem-focused approach that aims to help individuals develop new skills to cope with their difficulties. And then finally, humanistic therapy, on the other hand, emphasizes the importance of the patient's subjective experience and their personal growth. And so it emphasizes the importance of creating a safe and supportive environment for the patient in order to explore their innermost thoughts and feelings. And this approach emphasizes the patient's self-determination, their empowerment in self-actualization. So in the next sections within this lecture, we will examine these three types of psychotherapy in more detail. We'll explore their history, their theoretical underpinnings, some techniques used, and their efficacy, and I'll maybe throw in a couple of clinical case study examples to give you a more practical sense of what is going on in each of them. So overall, what is psychotherapy? Psychotherapy is based on basically talk work done with a therapist. And so it is something where you talk through your issues in a way and in a manner and in a style and using certain techniques to help overcome whatever mental challenges a person might have. So in today's lecture, of course, I want to have a story. We'll then take a look at psychoanalytic therapy, cognitive behavioral therapy, and finally humanistic therapy. Now, I want to start off with our story. And I'm going to give you the name of this lady in this photo here. And her name in psychoanalytic circles and psychotherapeutic circles is known as Anna O. Now, her real name is Bertha Pappenheim, and she was one of the most famous patients in the history of the world. She was a patient of a doctor by the name of Joseph Breuer, who was a physician and a friend of Sigmund Freud. And Bertha was a young woman who was from a wealthy family in Vienna who developed various physical and psychological symptoms. She suffered from paralysis and speech problems and visual disturbances and experienced a range of emotional states, including depression, anxiety, and agitation. And Breuer began treating Bertha in 1880, and his approach was revolutionary at the time. He used a technique that he called the talking cure, which involved encouraging his patient to talk about her feelings and her thoughts and to express her emotions. And through this process, Breuer believed that Bertha could gain insight into the underlying causes of her symptoms and could gradually learn to overcome them. Now, during her therapy, Bertha would often talk about her experiences and her dreams. And Breuer would listen attentively and provide empathetic responses. In one famous episode, Bertha talked about a dream she had had when she saw a snake. And this led her to recall a traumatic experience from her childhood. She had witnessed her father engaging in inappropriate sexual behavior, and it had deeply affected her. Now, through the talking cure, Bertha was able to work through her psychological issues and eventually recover from her physical symptoms as well. And this case was significant because it demonstrated the power of psychotherapy and the importance of treating psychological disorders through talking and through introspection. And so Dr. Breuer and Dr. Freud went on to develop psychoanalysis as a field, which became one of the most influential and enduring forms of psychotherapy that we have. Now, the case of Anna O also highlights the connection between psychological and physical symptoms. And it showed that mental and physical health are indeed very closely intertwined. And the success of the talking cure with Anna O helped to establish the importance of the therapeutic relationship and the role of empathy and active listening in psychotherapy. The talking cure was, of course, a precursor to modern psychotherapeutic techniques that we have. So it's a precursor to CBT and humanistic therapy. And so that kind of gives us a little bit of an introduction to the next part of this particular lecture, where we will be exploring psychoanalysis, psychoanalytic therapy. So psychoanalytic therapy is a form of talking therapy that aims to explore and to resolve unconscious conflicts and repressed emotions that may cause distress in an individual. If you recall Freudian's personality development, the tension between the id, the ego, and the superego, basically Freud's goal was to help people to identify the tensions there and bring them into consciousness, even though they tend to be unconscious. And when they are brought into consciousness, then a person can deal with them and have much more control over them. So Freud was a Viennese physician who worked in the late 19th century, and he became interested in studying the human mind after encountering patients with these unexplained physical symptoms that had no apparent physical cause. And he believed that their symptoms were the result of repressed emotions and unconscious thoughts. And Freud began his research by studying hypnosis, which was popular at the time as a form of treatment. However, he soon abandoned this approach and instead began to use a method he called free association. Now, in free association, the patient is encouraged to talk about anything that comes to their mind without censorship or editing their thoughts. It's a way of getting past those conflict barriers that happen where the ego is limiting the id, or the superego is causing too much anxiety within a person. And the idea behind this technique is that the unconscious mind will eventually reveal itself through the patient's words. And Freud's breakthrough came when he began working with a patient known as Anna O. As I mentioned, this was tied in with Breuer. Anna was a young woman who was suffering from a variety of physical and psychological symptoms, including hallucination and paralysis. Now, Freud's colleague, Joseph Breuer, had been treating Anna using hypnosis, but she wasn't responding to the treatment, and so in this, Freud engaged in some free association. Now, through the process of free association, Anna began to reveal traumatic events from her past, including the death of her father and her feelings of resentment towards her mother. After she talked about these events, her symptoms began to improve, and Breuer and Freud believed that the talking cure was helping Anna to release these oppressed emotions and resolve unconscious conflicts. Now, the case here of Anna O was significant in the development of psychoanalytic therapy because it demonstrated the power of talk therapy in helping individuals to understand and resolve their emotional conflicts. And it led Freud to develop his theory of the unconscious, although it had been in the works already, which he believed was the key to understanding human behavior and psychological disorders. Now, Freud went on to refine his techniques and theories, and psychoanalytic therapy became a very popular form of psychological treatment for disorders. Now, Sigmund Freud developed psychoanalysis, which is the psychological approach that aims to uncover unconscious conflicts and these repressed memories in order to resolve the psychological disorders. So it's bringing what is unconscious into consciousness through techniques like free association, as well as dream analysis, as well as something known as transference. And Freud's development of psychoanalysis, while it began in the late 1800s and early 1900s, it was primarily focused upon treating hysteria initially, which was at the time what we would now call affective disorders today. And through his work with these patients, Freud began to develop his theory of the unconscious and the idea that psychological disorders were caused by that internal conflict between the structures of the personality. Now, as I mentioned, one of the techniques used is free association. Another technique is dream analysis, where the therapist helps the patient interpret the meaning behind their dreams in order to uncover unconscious conflicts and emotions. Then there's transference, and transference is another concept in psychoanalysis where the patient transfers their feelings and emotions from past experiences onto their therapist. So you can simply explore how a patient feels about yourself as the therapist and gain a lot of insight there that you can help the client to explore. And this can provide some valuable insights into the patient's unconscious conflicts and help them to resolve them. So in essence, psychoanalysis is a psychological approach that aims to uncover unconscious conflicts and repressed thoughts, feelings, motions, and memories in order to resolve psychological disorders. And this approach involves the use of techniques like free association, dream analysis, and transference. And a typical session involves the patient speaking freely while the therapist listens and provide some interpretations and feedback. And Freud's development of psychoanalysis was influenced by his work with patients suffering from emotional disorders, affective disorders, things at the time like hysteria. And the belief that he had was that important childhood experiences would and could lead to the development of an adult personality that was dealing with struggles. And we see this in research today, that early childhood events can impact even the gene expression of how the brain functions. So he was groundbreaking at the time, and a lot of what he has to say still is of value today. So psychoanalysis is still around as a professional approach to psychotherapy, and I encourage you to delve into this in your own time and in future courses later on, as it can be valuable insight, provide valuable insight for your understanding of yourself, as well as for engaging others. And we will pause there and take a bit of a break, and we will come back and explore cognitive behavioral therapy and humanistic psychotherapy. I'll see you in a little while. You take care. Goodbye.